Question. Look carefully at the pattern before choosing the answer. We have a 32-year-old woman with 3 months of slurred speech. She has become clumsy while preparing food, and her handwriting has deteriorated. So already this is pointing toward a cerebellar or coordination problem. But then notice the second layer of the case. Her husband says that for the last 6 months, she has been depressed and her personality has changed. So this is not just ataxia. There is also a progressive neuropsychiatric change. On examination, she has poor short-term memory, an MMSE of 22 out of 30, cerebellar dysarthria, limb ataxia, and gait ataxia. So we now have 3 important domains together: psychiatric change, cognitive decline, and cerebellar signs. The EEG shows diffuse bilateral slow delta activity, but importantly, there are no periodic complexes. Now look at the options: sporadic CJD, variant CJD, frontotemporal dementia, Huntington's chorea, and Alzheimer's disease. Before moving to the answer, pause here and ask yourself, which diagnosis best explains a young patient with progressive neuropsychiatric change, cerebellar ataxia, cognitive decline, and EEG slowing without periodic complexes? Answer. The correct answer is B, variant Creutzfeldt-Jakob disease, or variant CJD. The strongest clue is the combination of young age plus early psychiatric change. Variant CJD typically affects younger patients compared with sporadic CJD, and it often begins with depression, behavioral change, or personality change before the neurological picture becomes obvious. The next clue is the cerebellar involvement. This patient has dysarthria, limb ataxia, and gait ataxia, along with progressive cognitive decline. That combination fits variant CJD much better than a primary psychiatric illness or a typical dementia syndrome. Now compare it with sporadic CJD because that is the main exam trap. Sporadic CJD is usually seen in older patients, and the EEG more classically shows periodic sharp wave complexes. Here, the EEG shows diffuse slowing but no periodic complexes, which supports variant CJD rather than classic sporadic CJD. Frontotemporal dementia can cause personality and behavioral change, but prominent cerebellar ataxia and dysarthria are not typical. Huntington's disease can cause behavioral and cognitive symptoms, but you would expect chorea, often a family history, and the typical autosomal dominant pattern. Alzheimer's disease is very unlikely at this age, and it would not explain the cerebellar signs. So the key teaching point is this: in a young patient with psychiatric change, cognitive decline, cerebellar ataxia, and EEG slowing without periodic complexes, think variant CJD. MRI brain may support the diagnosis, especially if it shows the pulvinar sign.